Hi, welcome to the evaluation of my interactive application SEPTA. This is part of my master's thesis, To what extent are machine learning adverse drug event classifiers comprehensible by clinicians? The purpose of this session is for you to use the tool freely and thereafter provide feedback in a questionnaire. The tool is based on a machine learning algorithm that predicts the presence of Stevens-Johnson syndrome from electronic health records. The application is intended to help understand how it made that prediction. It is a prototype of something that could be integrated in an EHR system at later stages. It aims to address three needs that were identified during discussions with practitioners and in literature. One, the reporting burden for unexpected and serious cases with regards to the complexity of causality assessments. Two, time-intensive reporting process. And three, better assessment of level of harm in time. Stevens-Johnson syndrome was selected since it is often fatal and unexpected due to its idiosyncratic nature. 368 cases were used from the Stockholm EHR corpus to build the model, which has an accuracy of 97% and also 97% specificity and sensitivity. Now, the intended use case is for a physician to adopt the tool as one of his patients has developed severe skin reactions. The application would trigger a warning saying that it has identified an event. The practitioner could then use the tool during the causality assessment, but also to fill out ADR reporting forms without having to look at the entire record, therefore reducing the reporting burden and also saving time. The cases that you will see in the prototype web application have all been predicted with Stevens-Johnson syndrome, and I'll now take you through the web application before you use it yourself. So here I can select a patient case, and I can select, I decide to select patient 3. Up here I'm warned that the algorithm has identified Stevens-Johnson syndrome. In this table I have the list of all features. These include clinical measurements, diagnostic codes, and medications, which are all listed in this feature name column. The days to event indicate the days prior to the Stevens-Johnson syndrome event, being day 0. The identification day is always day 0. The feature weight, which is the weight attributed by the model of a feature. So the higher the weight, the more important it is in a given prediction. The feature count is the number of times a particular feature has occurred in previous cases. The feature code may refer to the ICD code for diagnostic codes, ATC for medications, and MPU for clinical measurements. Now, in this first graph, we have the shift in probability of the event occurring in time. So, of course, at day 0, we have a probability of 0. This is a survival graph, which is a statistical measurement. And so we can observe the shift in probability in time. And if I change cases, we can see how that plays an importance, since some patients were predicted to have a much steeper change in probability on a shorter time period. Now the second graph shows me the features that were included for a specific patient. On the x-axis, we again have days before event identification, and on the y-axis, we have the feature count from previous occurrences. And the circle size, so each point refers to a feature, and the circle size of a feature refers to its weight as well as its color. So a yellow circle, which is always larger, has a higher feature weight. Now we can select these and they will be highlighted in the table to ease the assessment. Now I want you to use this tool, and I want you to go through several cases, if not all, and place yourself in the role of making the causality assessment, or if you were to fill out an ADR reporting form. I want you to ask yourself whether there is the information that you need, if there is something missing, if there is something unclear or clear. Reflect on the tool as if you were using it as part of an EHR system. The questionnaire that will follow will ask you about these reflections. Now I thank you for your time and look forward to hearing what you have to say. Bye.